Hi, my name is Greg Fell. I'm Director of Public Health for Sheffield, and this is a short video on Ramadan coming up. So the holy month of Ramadan is nearly upon us, and a number of people have asked me to set out my thoughts on the right advice and the right approach. Obviously, Ramadan is upon us, but this is advice for any religious denomination in any context. We're trying to encourage people to stay safe at all points and to limit the spread of infection. We're at the peak of the first wave of the pandemic, and we want to keep it that way and head in the right way. So the month starts this week. Clearly, you'll know as well as me, it's an important time for the Muslim faith and time where we traditionally spend time with our families and our communities and come together to pray regularly and to break fast at sundown with family and friends. You will know as well as me, the national lockdown has resulted in the closure of mosques and a ban on large gathering, religious or otherwise, and that's prevented communal prayers and from people coming together for the shared meals of Suhoor and Iftar at the end of the daily fast. So we're asking people this year to observe Ramadan and celebrate differently. And there's one purpose for that, and it is to reduce the spread of COVID-19, to protect the vulnerable, to save lives, and to protect the NHS. A part of Ramadan is about being selfless and doing good deeds and reflecting on those who are less fortunate than us, and staying at home is one good way to do that. Some other thoughts. Don't eat communally from the same plates of food as others unless you live in the same household. Be aware that people may choose to shop in large numbers prior to breaking fast, and we'd encourage people to stick within the social distancing guidelines for that and stay 2 meters apart from others. And if you're preparing food for a vulnerable person, often a very old person or a very poorly person, wash your hands regularly for at least 20 seconds with hot soap and water, and don't enter the house of others when delivering food. Why can't gatherings take place? It's really simple. Large gatherings encourage the spread of a virus because they encourage people from different households to mix with each other, and that's really, really good for transmitting viruses. Particularly risky if people are living in households with multiple generations, so mum, dad, grandparents and children all at once. So what we really, really want to do is protect those that are most vulnerable to severe illness, because the evidence is showing us that they're more likely to have a very, very severe illness. So it's worth remembering that Ramadan focuses on self-purification, rejuvenation during the month, and almost all Muslims try to live more healthily during that month-long period. There's lots and lots of support that's available for people on quitting smoking, doing more exercise, healthy eating. It's never been a more important time to stop smoking, and look for the hashtag Quit for COVID, and you'll find all sorts of help and support and access to the various services that we offer. Search for Smoke Free Sheffield, Move More or Live Lighter, all really available online, and you'll find all sorts of support there. I'll end with some advice for returning travellers. I'm well aware that people will be coming back to the UK from overseas. They may be coming from parts of the world with a different approach to lockdown, and they may not know what PHE and government guidance is being recommended in terms of social distancing and staying at home. So it's important, if one of your relatives or one of your friends is coming back to the UK, that you make sure they know what the current message is and that they abide by that along with the rest of us.